Hi, my name is Pam and I'm going to be your nurse today.
I'm Carson.
I'd like to perform a head-to-toe assessment. Would that be okay?
Yes, it
Do
will.
you have any questions before I start?
I do not.
Okay, I'd like to wash my hands first. General appearance, you look healthy, you're dressed appropriately, your mood and affect are good, your mobility is good, you overall look like you're in pretty good condition. Starting with your head, I'm just going to start with the head and move all the way down your body. Normally I would have gloves on. Tonight I'm not wearing gloves. It's my son. I'm going to inspect his hair. I don't see any bruises. I don't feel any bumps. There's no infestations. His hair is in good condition. Your skin color is good. Your eyes and your ears, your nose, that's all symmetric. Your nose and mouth are midline. Check your TMJ joint. Just open and close your mouth. Your temporal artery, that would be 2+ and bounding. A little bit of acne on your face, but otherwise no skin breakdown. Moving on to your eyes. You're measuring your pupils. I have this chart here, help me out. Your pupils are 3 millimeters bilaterally. Cranial nerve, optic nerve, you can see the oculomotor nerve is cranial nerve number 3. I'd like you to open and close your eyes, that's intact. Cranial nerve 4 is your trochlear nerve. I want you to move your eyes up and down, side to side. Abduction nerve is 6 and go side to side of your eyes. Those are all intact. Now I'm going to do some tests with your eyes. I want you to cover your left eye. I want you to follow this with your right eye. Okay, cover your right eye. Okay, uncover both eyes. Look up here. Just follow the light to the different cardinal positions. Okay, cover your left eye again. I'm going to come close, and his pupil constricts on the right to 2 millimeters. Cover your right eye again, come close, 2 millimeters. I want you to look at an object behind me, and then follow the light. His pupils are equal, round, and reactive to light and accommodation. Looking at your eyes, there's no swelling, there's no drainage, there's no lid lag or ptosis. Your eyes are in overall good condition. If I had a Snellen chart, we would do an eye exam at 20 feet away, but that's not available to me tonight. Moving down to your nose, cranial nerve 1 is your olfactory nerve. I'm going to have you close your eyes, and I want you to smell a substance, and you tell me what it is, please. Smell that?
Yep.
And what is that?
Vanilla.
Okay, good. So his olfactory nerve is intact. His nose is midline. I don't see any discharge. I'm going to check for patency of his nares. I'm going to occlude one side and have him breathe, and then occlude the other side. Okay? There's air movement noted out of both sides of his nares. They are patent. I'm going to palpate your frontal sinuses. They're up here. Your maxillofacial sinuses are here, and they are not enlarged. Ears, I don't have an otoscope, so we're just going to do the best we can. Cranial nerve 8, I'm going to do what's called a whisper test on you. I'm going to have you cover your right ear, and I'm going to whisper 2 words, and I want you to see if you can hear it in your left ear.
Orange banana.
Okay, cover your left ear.
Car trunk.
Okay, his acoustic nerve is intact. Looking in his ears with my flashlight, there's no debris or cerumen on the left. There's no debris or cerumen on the right. Palpating the pinna and the tragus. On the left, there's no nodes. Again, on the right. If I were to do an ear assessment, it would be pinna is up and back. due to his age. If I had an otoscope, I would look at his tympanic membranes and they should be pearly gray. His mouth, cranial nerve 5 is his trigeminal nerve. That's your chewing. Can you chew up and down? Can you chew open against force? Yes. TMJ we already checked. Cranial nerve 8 is your facial muscles. Can you smile, frown, eyes up, eyes down, eyebrows up, eyebrows down. Your glossopharyngeal nerve, stick your tongue out, move it from side to side. You can chew, you can swallow, and I'm not going to check your gag reflex. Vagus nerve is 10, that's talking and swallowing, that's intact. Hypoglossal is movement of tongue. Okay, your trachea is midline. Cranial nerve 11 is your accessory nerve. Can you move your head down and from side to side? Okay, your jugular veins, they're nice and flat, they are not distended. Next, we're going to look at your mouth. I'm looking at your lips. They're pink. They're not chapped. If you open your mouth, stick out your tongue. Your tongue is pink, healthy. It's not beefy red. It's just pink. And it doesn't look like it's dehydrated. Open. I want to see your teeth. I don't see any cavities. Your uvula is midline. Your tonsils are not enlarged. Your carotid artery, I'm only going to palpate one side at a time. And then I'm going to listen with the bell on my stethoscope. No bruits were noted. Moving on to your musculoskeletal. I want you to stand up for me, please. Can you put your arms out? Can you rotate them? Good. Can you rotate your wrists? Wiggle your fingers. Move your hips. Okay. Move your knees. Ankles. Wiggle your toes. I want to grip my wrists, my fingers, your strength. Okay. Can you push against resistance? I'm going to push you against resistance. I'm going to have you sit down. Look at your feet. Can you push against resistance? Push you. At the same time, I'm looking at his nails. His nails are in good condition. There's no fungus or anything like that. The bottom of his feet don't have any open areas. His other foot, push against resistance. Push you against resistance. His nails are in good condition. There's no open areas. His legs don't appear to have any lesions, open areas, or bruising noted. Moving on to your heart. I didn't notice any edema when inspecting you. Your capillary refill is less than 3 seconds. Over here, capillary refill. That's also less than 3 seconds. Check on your toes. That's less than 3 seconds. That's also less than 3 seconds. I'm going to palpate your apical pulse, which is on your chest. Your radial pulses. I'm going to listen for 10 seconds. He has a nice, regular, strong pulse. His pulse is 72 and regular. Now I want to listen to your heart sounds. Your apical pulse is at your second intercostal space on the right. Which is nice and regular. Then we're going to do the pulmonic, which is left of the sternal border. Erb's point is just below that. Tricuspid is on the fourth intercostal space. And the pulmonary is the fifth intercostal space, which is also the point of maximal impulse where the pulse is heard the loudest, which is correct. Moving on to your lungs. I'm looking at you, you're not using any extra effort to breathe. If you lift up your shirt for me, your breathing is normal, you're not using any accessory muscles, you don't have a barrel chest. I'm going to listen to all 4 lung fields on your back. Just take a deep breath when I ask you to. Deep breath. Deep breath. Deep breath. Deep breath. The arm. His lung sounds are all regular. They're not diminished. There's no crackles, no wheezes, no adventitious breath sounds were noted. Other thing, I'm going to listen for respirations. For 10 seconds, I'm going to listen. I get respirations of 18 that are even and regular. Moving on to his abdomen, I'm going to have you lay on your back. The first thing I'm going to do is listen to all 4 bowel sounds. Are you having any difficulty pooping or peeing?
No.
His bowel sounds are normal, active in all 4 quadrants. I'm just going to do some light palpation. You just let me know if this hurts, okay?
No. 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 No.
Okay, now I'm going to just do a deeper. Just let me know if it hurts.
No. No. Nope. No. No. No.
His abdomen is not tender. As far as assessment of his skin, looking at his arms and his legs, his back, and his abdomen, I don't see any bruising noted. His skin color is appropriate. Otherwise, this is a complete physical assessment. Do you have any questions?
I do not.
Okay, thank you for helping me.
Thank you.